Hello, everyone. Welcome to the One Eastside Spark webinar series. Today is September 30th, 2021. My name is Christina Hudson. I'm CEO of One Redmond and founding partner of One Eastside, and I'm going to be your host for today's program. One Eastside Spark is a regional and recovery resiliency center funded by federal grant dollars. And this program is designed to help fortify your small businesses with the resources, expertise, and additional key areas of support. And the goals of these programs is to help our businesses thrive and to withstand future economic crises. Spark is a collaboration and a partnership, and I want to thank all these partners here on the screen. These are all our Eastside cities, our chambers. We're all partnered together to give the highest level of support to our local business community. And I want to thank everyone for all the work that they are doing. This next slide shows you an overview of Spark's current programming, and that includes a database of financial opportunities and other resources, a private group, a Facebook group that we use as a platform to help our small business owners connect with their peers about challenges and opportunities. And also, one of the key components of our program is our free of charge one-on-one advising. Our federal grant pays for the time of these additional experts so that these advising appointments are at no cost to you. And currently, we are offering 2 hours of tax and accounting advising through our partnership with Clark Nuber. We also have a wonderful marketing expert, Daphne LeBlanc, and she can help you to promote your business on social media. And for general advising, you can contact Sean Palmer, the SBDC advisor for East King County. Through Sean, you also have access to a network of a number of different advisors with various expertise. And I also want to note that one of our speakers here today, Michael Rice, is another business advisor you can reach out to as well through our Restartup 425. So our next slide has some of our upcoming webinars and programs that are also available at no cost to you. Next week, we have an update on funding opportunities for East King County organizations. And the following week, we have our own Sean Palmer giving another fantastic presentation in his Entrepreneurs Roadmap series. And one thing to note, all the webinars that we produce are on demand as well. We cover a variety of different topics that you can watch and learn at your own pace. So we definitely want to make sure you check that out on our website. And I think the next slide, when it clicks on through there, we'll go ahead and there it is, oneeastside.org/program. So definitely check that out if you haven't seen some of our other resources that are available to you. All right, we're going to go ahead and move on to our program. Today's webinar is all about how to prepare for winter. And before we get started, I want to cover a few housekeeping notes. If you need technical help during the webinar, please use the chat box. We have staff on hand to try and help with any issue you may be experiencing. We also have links to pertinent documents in the chat box that you will be able to access. The resources we have here will also be available on our website, as well as being included in our follow-up email to you. If you have questions for the speakers, please use the Q&A box and feel free to share all of your questions here, and we will do our best to get as many answered as possible right here, right now. But please note that the webinar is also being recorded. We'll send a link out to you. We'll also get a transcript of all those Q&As that are asked. Our programs are all designed to help you navigate through all the information as we know it today. And we know in this changing pandemic, it's still a dynamic process. So as of right now, all the content you will hear on this webinar is accurate. And our speakers are working very hard to provide you with the most up-to-date information and guidance available. So let's get going on with the program. Today, we have Ann Alfred, Rhoda Mohammed, and Jenna Trong from Community Toxics Science and Policy section of Seattle and King County Public Health. We also have Michael Rice, Business Advisor of Business Impact Northwest and Restartup 425. And now I would like to turn it over to the team from Seattle and King County Public Health. I'm not sure which one of you is starting out, so I'm going to pass the baton to you.
Rhoda, you're muted.
Hello, everyone. Welcome to our presentation. I'm starting the presentation. So Next slide, please. Our agenda today is offered to you and objective is indoor air quality. Why is it important? How does it work? How can we improve it? Private sector considerations, examples, resources, and at the end we will have question and answer. Our objectives are having awareness of the importance of healthy indoor air, understanding natural ventilation, local exhaust, and mechanical ventilation, and how they affect the airflow in your building or spaces, using your understanding in the directional airflow in your spaces to maximize air quality. So why is indoor air quality important? Indoor air quality is important because the average person spends 87% of their time indoors. And because of the COVID, that number increases. So now the majority of our time we spend indoors. Good indoor air quality can help reduce the airborne transmission of COVID-19 and other viruses. If we look at this picture, the Delta variant spreads more easily than virus variants. It may cause more than 2 times as many infections. So Delta virus is more dangerous than the original COVID strain. Next slide, please. Indoor air can be more polluted than the air outside due to common household products and activities we do all the time. When we think of air pollution, it's important to consider our indoor air, the air in our homes, our workplaces, in the schools, in childcare, in like face-based places, or in any place we share. The Environmental Protection Agency, EPA, has found that indoor air is 2 to 5 times more polluted than the outdoor air and considers contaminants in the air among the top 5 environmental risks to public health. So, for example, activities we do inside in our homes that change our indoor air quality are like cooking. When we cook, especially when you are frying and using oil, it changes our indoor air quality. And when, so please, when you are cooking, it's better to open the kitchen hood because it pulls out the contaminated air and it pulls in new air in. So also opening the windows and doors will dilute any pollution in your air. So if the weather allows, it's good to open the doors and windows when you are cooking. The other items inside our home that also pollute our indoor air, like toys, furniture, carpets, sprays, all them, they produce fumes and chemicals that also changes our air. Materials used to build our homes like paint, ceiling, flooring, insulation, they also have impact in our indoor air. Next slide, please. Impacts of poor indoor air. Why indoor air matters to your health? Because better indoor air equals better health. We cannot see or touch the air we breathe, but it has an important impact in our health. So understanding and controlling the quality of our indoor air can help us reduce the health impacts of poor indoor air quality. Some impacts are immediate, like irritation of the eyes, nose, or throat, headaches, dizziness, fatigue, cold or flu-like symptoms. You may get it the first exposure. Like if you are using, when you are cleaning in your home, if you are using like in bleach, that may irritate your eyes. And the long-term and indoor air, poor indoor air impacts may be cancer, respiratory diseases like asthma or COPDs. And if you have any existing condition, it may make it worse. Next slide, please. Why do we want to listen impacts of poor indoor air to protect our most sensitive people? So young children are the most sensitive population. Many studies show that the most sensitive population to poor indoor air quality are young children. The same concentrations of pollution can result in higher exposure to young children because they breathe more air than adults. And also their body is still growing and developing, and the potential for damage to their respiratory and neurological system is greater than adults. Also, people with respiratory diseases or illness, heart disease or chronic diseases, the poor indoor air quality, it will impact also their health. People over 65 years of age, people who have or have had COVID-19, people experience the effect of environmental racism. For example, if you live in an industrial area or close to highway, you don't have option to open your doors or windows and get fresh air. When you live in that area, your outdoor air is very toxic, so you cannot open your doors and windows and get fresh air. Also, pregnant women is very sensitive because when women are pregnant, anything they inhale, or if they live in a poor indoor air, anything they inhale goes into their lungs, and then it will go into their bloodstream, and that bloodstream is the same blood that the baby is getting, so it will affect the mother and the baby at the same time. How do viral particles spread? Viral particles spread in different ways. This is how much droplets we produce. If you have, for example, COVID-19, and if you cough or talk or breathe or sneeze, you will produce this much of particles and droplets, and this contains the virus. So for example, COVID-19 spreads in 3 main ways: breathing in air when close to an infected person who is exhaling small particles and droplets that contain the virus. So if you are close to that person, you will inhale any droplets or particles that comes from their breathing area. Also, having these small particles and droplets that contain virus land on your eyes or nose or mouth, you will also get infected with the virus. Also, touching your eyes or nose or mouth with hands that have the virus, that way also you can get the virus. Next slide, please. So COVID and other viruses with airborne transmission can come from mouth and noses. Think of every person as a potential source of virus. Particles come out of our mouths and noses and circulate as droplets, go back to us, and circulate as droplets and particles in the air. So we are trying to keep the particles from being in the air. So to keep that particles from being in the air, we have to wear masks. And also we are trying to dilute the particles in the air by using the natural ventilation, opening your door and windows, and also making all your bathroom fan on all the time. We are filtering the air to remove particles by using like HVAC system if you have, and putting your HVAC system a very high efficient filter like MERV they did. You can also use HEPA air purifiers, and that way you can remove any particles in the air. Next slide, please. COVID and other viruses from mouth and noses, like wearing masks can contain 20 to 60 of the droplets coming from people's mouths and noses. You can also limit people use a room or space if you can. Open windows and doors as safety and as weather permits. You might want to put a fan, a window that blows out all the contaminated air and bring this in, like not bring in the contaminated air. You don't want to push or pull dirty air around lots of people. For example, if you put fan in your space and there is somebody who is producing these droplets that has viruses, the fan will blow around the people that dirty air, and more people they may get infected with the virus. Keep bathroom exhaust fans all the time while the building is occupied on, because they will pull out the contaminated air and bring in clean air. Next slide, please. Ventilation and filtration. Ventilation is bringing in fresh air, and filtration captures and removes particles from the air. Natural ventilation. If weather permits, it's good to bring as much as fresh air as possible by opening window and doors. And if we look at this picture, like pool ventilation, no open windows, no fans, no portable air cleaners. So you can see the air of this room has a lot of it's very contaminated. And the good pool ventilation, when you open windows, if you have ceiling fans that can filter the air, and window exhaust fans that blows contaminated air out, and you also have HEPA air purifier, then the indoor air of your space will be clean. So if you are using fans in a window to blow potentially contaminated air out, and pull new air into the other open windows and doors. So now Anne will talk about mechanical ventilation.
All right. Thanks, y'all. So I have been doing some ventilation work for the last year and a half, or ever since we determined that COVID was airborne. So working in a lot of sites with this. If you guys have questions, so I'm going to go through mechanical ventilation in a space or in your space. So if you have questions, just because it's a little bit dry and a little bit technical, tell me if I'm not making sense. I talk about this all the time. Mechanical ventilation, oops, can you go back, please? Mechanical ventilation. So natural ventilation includes opening doors and windows and just getting air in. Mechanical ventilation is every other thing that is going to pump air through your building or your home. And starting with local exhaust is a kind of an easy one, because bathroom and kitchen fans will pull your air out. So that's a kind of an easy way to at least start getting more air through your building. And if your bathroom fan's not working well, it's also a fairly cheap fix to go and improve the flow of the bathroom fan going through. Next slide. So your HVAC system, if you have one, heating, ventilation, and air conditioning system, is the most reliable way to move air in a building, just because it's been built into your building. You have the ductwork and a furnace that is pushing air and pulling air through your building. The HVAC is comprised of your air handling unit. And an important thing to do is, if you've got a building manager or if it's your own building, is to get a professional if you can't do this, but find that your outside air intake is open and able to, that you're able to pull as much fresh air from the outside as possible. Sometimes this is dampers for an HVAC system have been closed because people want to, our focus has been towards energy conservation and keeping air in, and COVID turned all of that on its head. Now we want to open up and let fresh air into, or outdoor air inside. So there's ventilation or dilution and filtering. Filtering the recirculating air is really important for removing particles in the air. And Rhoda mentioned a MERV 13 filter, which is a filter size or a density of filter fabric that will remove about 75% of particles in the size that COVID is. So COVID is about 0.3 microns, but a lot of times, as we are our source, here's my source of COVID particles, if I had it, are going to be attached to spit and water. And so they're going to attach to larger particles. So the MERV 13 filters are really important for for capturing particles as they're moving through your system. Make sure your system's maintained, clean, replace filters. Filters can get dirty pretty quickly. They get dirty with smoke. They get dirty depending on where you're at. And make sure they're properly seated. We've definitely seen a lot of systems where the filters are kind of sideways or not tightly, and so the air is flowing around. So that's something you can do, or you have your maintenance person or an HVAC specialist take a look at. Next. So this is a very simple schematic, but a lot of you, like if you'll go look at rooftops or in the back of buildings, or sometimes they'll be in the closet or in a back room. A lot of strip malls or shopping complexes will have a room dedicated to this, but the fresh air is going to come in through here, move through the system, and it's going to blow. A lot of times your air supply vents are going to be at the top. It's going to move through the room, and then it's going to come back out through a return grill. If the air is circulating, there's going to be a filter in here to keep some, and a lot of times when it's cold or really hot or really smoky, you're going to have less fresh air coming through and more air going through the filters here. So it's really important to manage those. Next one. So this is what it's going to look like inside the room. So if you all are sitting in a room, take a look. If you're in an office setting, like at my office, I sit underneath one of these and it blows cold air on me. So take a look if you can at where your supply vents are. I'm in my home right now. I've got a supply vent right behind me, and I have a return grill over in the other room. I'm in my dining room, and there's a return grill in my living room. So when you look at where your supply air is coming in and where your return is, everybody take a look at that if you've got those, and see which direction your air is flowing through your space. Does that all make sense? That's what we're going to be looking at. That's one of our pieces of information. So sometimes opening windows and doors, someone had put a question in the chat about opening windows and doors. Sometimes it's a great idea depending on the airflow or where the wind's coming. And sometimes it can just mess up the directional airflow of this. But usually, almost always, opening doors and windows is going to be a good idea. We almost always want more air coming through a space. Let me go to the next. So the way that the CDC and infection control air monitoring is measured is in air changes per hour. And so some of you might have kids in school and have been watching how the kids' school have been talking about, we are getting the CDC recommended air changes of 5 to 6 air changes per hour. This is really important. And one of the things that COVID really brought on is that a lot of buildings were not getting adequate number of air changes. They were getting 1 or 2, and a lot of places have really upped their game, added motors to that air handling system, that picture that I showed with the air coming in, and then there's motors pushing it around, or airflow. So more air changes. Again, we're bringing in more air by dilution, by opening dampers, and upgrading our filtering ability if we can. And understanding in your space, the directional airflow in your space. I'm just gonna ask another question. Some folks might be in a building or they've got other businesses on each side, and you share air. That's going to matter for your directional airflow depending on the leakiness of the building, what's happening next door. If you're next door to a kitchen or a restaurant that's got a big hood system blowing, or some other business, if you're next to a nail salon that might have some odors and they've got extra ventilation, all of these things might matter for your airflow in your space. Air is a really chaotic thing. We try to tell people to imagine air coming from their supply vent and going to the return as a stream, like you're at a, like a river or a stream, and it's coming through and going this way. The air's more chaotic than that. So there's a lot of different factors. Consider adding extra filtration in places. As you look around, you might be able to see it's like, oh, I've kind of got a dead spot over there because my airflow is coming from here and it's going there. But like if you're a childcare or something, you might have a little pod of kids over in an area that's kind of dead space. And you might want to add either box fans with MERV 13 filters or true HEPA portable air purifiers. And we are going to talk at the end about our program and how we do assessments for people and answer questions. So we're able to help you with your directional airflow, with assessing your space, where to add MERV 13 filters, where HEPA filters might work best for you. So next slide. So this is a box fan with a MERV 13 filter. We've been kind of pushing these in schools lately because a lot of school classrooms, like if you get 26th graders, they're kind of sweaty and bouncing around. A lot of schools have purchased HEPA filters, but the teachers really like having a fan and having blowing air. So what this is, you're going to put your MERV 13 filter on the back or the intake of the fan, and then blow the air like at a wall. So this is the air coming in, and this is going to be the air blowing out. So not your usual fan where you put a fan in front of your face and let it blow. You're going to be putting the front of the back of the filter towards where people's mouths and noses are creating aerosol, and then letting it blow onto a wall or a space so that it can indirectly add air to your room. What is great about these is they're cheap, they're easy to move around, and you can, if you have an activity happening, if you're a community center or a church a faith community that acts like that, and you've got a meeting, you can pull these into a space really, really easily. Next slide. And then true HEPA filters. These are also really popular, and what they do is a HEPA filter. So the MERV 13 filter that you put on your box fan will capture about 75% of particles in the size of COVID. A HEPA filters are going to capture 99%. So a 75% versus 99%, you might say, I'm going to get the 99% one, of course, because it's better. But the box fan filter can blow more air, so you're getting a smaller percentage, but more air going through. These are better for capturing everything. They both have really good applications in buildings. We've put a lot of these into childcares and some of our communal homes, adult family homes, senior centers, that kind of place. And they really work well. They don't make it cold. You have a pre-screen, especially for places that are kind of get a lot of traffic and can be dirty. We've put these into some of the day centers for homeless folks down in downtown Seattle, where they get like just dirty air coming off. And so they have this filter that comes in the front, can capture a lot of the dust and dirt. There's a carbon filter, so that's going to take out the volatiles. And what that is are like the odors, smoke, cooking odors, things you can smell, or that. And then the true HEPA filter, which is just a very pleated filter, and it captures the viral particles go here to die, and then it goes through the motor, and then the clean air comes out the top. And we can also help you with any of these, helping you to size these for a room. A lot of these will have you've probably seen the ones with a round filter that pull in from all different directions, but we can help you with sizing it for a room, placing it in the best place. There's a little bit of, figuring out your room volume, how many air changes you need based on if you've already got a HVAC system or if you've already got air coming through. So we can help you to get to the number of air changes that's going to make your inside air healthier. Next, and I'm just going to look at the chat.
Great.
Jenna's going to start on this part, but I'm going to just leave space for this chat. So I guess the general question, we lease a space, we're asking landlord to enhance ventilation. Are there any legal requirements or funding resources for him? There aren't legal requirements. Indoor air doesn't have any kind of, there's guidelines, and there are guidelines for certain industries like, of course, clinics or, a place where you've got infectious particles coming out already. A dental office are going to have those. And the funding resources, we do have some, and I think that is coming up later. And then the next general question, I don't have a big budget to make a lot of improvements. I have enough money to do one or two things. And this person that sent this, we're going to have an intake form in our email at the end. And I would, we can have a conversation, probably some of the things to do, or maybe putting fans in windows. I was at a gym where their windows only opened a small bit, and we got them to open their windows all the way and to support that so that they could blow more air in from the outside rather than, how gyms have all their air blowing at people through there. So it's pretty site specific, and we're happy to, just chat through your, what your business looks like, where you're building, where your people work, and help you with that.
Great. So we're going to skip over a couple of these slides that are where to start. I'm sure you'll have access to them after the presentation. These are really just emphasizing a few of the points that Anne made earlier. And let's see, we'll go into some sector considerations. So each of your sectors is going to be very different. A lot of your sectors will kind of determine the spaces that you're in. For instance, with faith-based organizations, we see a lot of complexity and variation in the size, especially having higher ceilings. That's something very common in the work that we've seen. So that will impact the kind of HEPA units that you're going to want to purchase if you're interested in purchasing those. Sometimes UVGI, which is upper room, ultraviolet upper room germicidal irradiation, that'll take care of the air up higher, but that's a more costly sort of way to address your concerns. Or you can get wall-mounted HEPA units, which will take care of larger spaces. And then we look at childcares, we'll see that some solutions may not be as applicable to you. For instance, box fan filters, there are opportunities for children to get their little fingers stuck into the fans. So sometimes we'll go in towards recommending HEPA air cleaners because they're a lot more child safe and there's no opportunities for things to get stuck in those little spots. And there are also a variety of activities that happen in each of these sectors. For instance, in child cares, we tend to look at whether nap time is happening in a different space and how you can move things around your space to make the air quality better depending on the activity that's occurring. And for a lot of restaurants and small businesses, we know that there could be differences in the kinds of activities. So if you're eating in a restaurant, you're not going to have your mask on. One way to address those concerns is just having a lower capacity, which can be very difficult. But when you're in a higher risk situation like that, sometimes that is what you have to do in those situations. And in retail stores, sometimes we'd recommend flushing out your space between groups of customers, for instance, in restaurants, or between groups in childcares. And you may not be able to do that because you have a constant influx of customers during the day and you can't just close it off for an hour. So those are just some of the considerations that we're trying to make when looking at each of your different sectors. And coming up, we have a few examples that we can run over. We won't really go too far into depth, but if you have questions at the end, we want to make sure that other presenters like Michael have time to do their bit. So right here, we're looking at a restaurant. We have a diagram showing seating, the register, the kitchen. There are some fans existing in there. Those were pedestal fans that blow air around. So we would recommend that those be removed from the space so that we're not blowing that dirty air around like Rhoda suggested earlier. And beyond that, we'd recommend that they'd have their bathroom fans on, that if it's possible, leave the front and back door open to create that passive airflow. And this individual was actually maintaining his HVAC system himself. So we would recommend that he contacts a certified HVAC engineer or another maintenance professional just to make sure these systems are really delicate and we want to make sure they're cared for properly. Next slide. In a complex, we have another problem like the one in the questions where maybe you're sharing a system. So there may be issues with landlords, other things like that. We usually address these by just creating a good form of communication with those individuals, expressing your concern. And if they aren't able to service the things, then we'd recommend coming to us and asking about whether or not you qualify for HEPA air cleaners and following through with those. We also see they have windows, so that would be one thing that we might be suggesting to them. But as we're going into winter, that gets a little more challenging, and that's where we're relying more on those sorts of portable air cleaners. So yeah, next slide. And this is just another example. We'll skip through this one just because we're low on time. And lastly, we have some resources. So Anne, Rhoda, and myself and our other team member, Daniel, we're the COVID recovery team. We're doing technical assistance and will be leaving us soon, which is so sad. But we are here taking intake forms and assessing the various businesses and their ventilation. And that link is in the chat if you're interested in getting assistance from us. And next slide. So this is just the questions that you'd be asked to answer. And then we also have some resources here. And lastly, next slide. Thank you. So we'll be willing to answer more questions at the end, depending on time and anything you put in the Q&A.
All right, thank you. And now we're going to turn it over to Michael Rice to talk about some best practices in safe operations. Michael.
Yeah, thank you very much. I have to admit, mine's not near as fun and energetic as the airflow stuff. I just learned a ton. I had no idea of all the various ways to protect your environment. But one of the things a lot of the businesses that I work with are asking themselves is, hey, how do we implement mandates on it with employees and customers, and of course, keep them safe, but yet we don't want to lose either of them, right? We need those customers and we need our employees. So there's one of the focuses that I wanted to do today was just best practices around these types of considerations. So next slide, please. Number one, we really believe and have found with our customers and our clients that if you focus on the employees, you end up getting the customers as well. And you're creating a safe environment for the both. So this is one of the things you really want to control is what you can control, and that is employees. Identify your high congregation areas and where there's congestion. Obviously in a restaurant, that might be your lobby, or if you're in a retail, that might be your checkout. Look for places where you can do some of those basic things like put a sanitation station there so that way they can sanitize, or have a hostess that may pass out masks and remind people to the masks are required between your table in the bathroom or the table in the lobby, that type of thing. And again, this is an environment where you want to safeguard not only your employees, but also it gets to resonate with your client base as well. And again, these are the best practices we're seeing out in the market space. And we work with lots of restaurants and small businesses, everybody from 100 plus employees all the way down to just a couple of employees. The culture of inclusion and avoid alienating employees who have a different view. We know that there are people that are anti-vaxxers. We know that there are people that don't believe it's really a threat. We also know that there are people that are very fearful of it, that are, oh my God, I don't want to touch anybody with it, or I don't even want to come to work because of it. So we want to create a culture of inclusion. And we do that by really focusing back on bullet number 1, focus on the employees. Listen, we're here for each other. We're here to create a safe environment. We still want to do those things that we've been doing for a while. We've been doing this now for a year and a half or so. So you're looking for that distance. You're trying not to congregate in an area too long or be too close to anybody, talking to them for too long of a period of time without some sort of mask on. You want to make sure that you've got real good cleanliness going on. One of the first things we did right out of the gate was revert back to some of our old practices, especially in the restaurant industry, where we reverted back to the practices of washing our hands frequently, making sure that we weren't touching our faces or hands and then serving food. Those types of things you just come right back to. So that culture is the same culture we've really been dealing with for a long time. We're just now emphasizing it. And it's okay for you to be this or feel that way or have these types of anxieties. That's all right. But here's what we got going on. And then, of course, if there's things like you're trying to create a mandate for vaccination requirements, people can't come in unless they have vaccinations, those types of things, you're going to really want to reach out to your legal teams and make sure that you're doing that correctly and stuff like that. One of the things that I'll do right now is in the chat, I will go ahead and put a link. And this is the state of Washington's checklist, and it's kind of a toolkit for businesses. And it's in your chat. And the nice thing about this is it gives you a lot of good ideas, how to work with your employees, how to get them implemented into a safe employee environment, and how also to create a non-confrontational approach when you're creating these mask mandates, even for your customers. You have customers come in who don't believe in this stuff, right? So how do you keep them from potentially creating an unsafe environment that resonates with all of your other customers that are very interested in keeping a safe environment? The constant reminder is the name of the game. The confrontation only ends up in a bad situation. So you're going to say, hey, listen, just a reminder, we require a match between here and the bathroom, and then leave it alone. Some people will comply, some people won't. We are seeing that the best practice of reminding and keeping people aware of the policy, the mask signs that say mask required, things like that. These are things that are valuable. And then to the point of the ventilation, if you're doing special things with your ventilation, announce that. Let people know what you're doing to create that safe environment. We have sanitation. We're giving away a blue mask. Whatever it is that you're looking to promote that safe environment for the employees, the customers will follow along. And it just, again, non-confrontational, a reminder, that type of deal. So there's a nice little checklist, like I said, I put out on the check. Next slide, please. Now, one of the things that I didn't want to overlook here, because the design here was, what do we do about winter? And of course, I focus on business. Yes, we have best practices to keep people safe. We've just talked about airflow. We've just talked about making sure that the environment is ready to go for the winter. But the other thing is there's an awful lot of business related issues that need to be addressed. And I'm not going to pound on them because we spent a lot of time on airflow and keeping best practices for providing a safe environment for employees, which will allow a safe environment for customers. Labor shortages are a big thing that you got to deal with. Seasonal sales adjustments will happen, so we may have some issues finding those workers to create that seasonal adjustment. Or you're going to have more customers in a small area, so you may have to think about, how do we redesign our store a little bit so that way you don't have that type of issue. There might be a slowing of sales, which you need to consider. New debt from the COVID downturns. These are things that may be of challenge to your business in particular, especially if you took like a EIDL or personal loan that's supposed to have an L on it, but sorry about that. And then lower net income due to rising cost and supply chain issues that are issues. And so my next slide, please. So just some ideas, because I didn't want to leave you, being a business coach, I didn't want to leave you just with best practices in how to wear a mask and how to talk to people and how to work with people and keeping a safe environment. But just look for things like using less individuals, but try to get a streamlined operation so that way you can get more out of the few people that you have, or even outsource certain things that historically you may have done inside the house, but there's probably an opportunity to outsource that would reduce the amount of labor you might need. When we're talking about sales, don't forget about things like benchmarking and coinciding with what percentages towards your revenue those are, because that's one of the big things. If you look at it from a gross revenue and the benchmark to your gross revenues, it will tend to give you an idea of what type of things you might want to reconsider when it comes to labor, especially, and then also things like what's selling, what's not, those types of things. Do we buy this? Do we not? Let's not have a bunch of products sitting in the back room that's not making us any money. With the new debt that you may have from any type of personal loan, really understand what the cost to hold on to that debt is, and then how it affects your cash flow. Recognize the two differences. And then, of course, lower net income due to rising costs and potential supply chain issues. You may not have it to sell, especially for some of these retailers as we get into the holiday season. There's a function of, hey, pay attention to these things. So I didn't want to just leave you with, hey, here's some masks and some keeping people safe stuff in the business, but also there's all this other business stuff that we don't want to overlook that happens. And again, you can reach to us and all the partners here, and there's lots of business coaches, Sean, myself, folks at the One Spark that will help you with the various business things. And then obviously more about that ventilation stuff that they're actually quite intriguing. Thank you.
All right, thank you, Michael. All right, now we are going to start our Q&A portion of the program. And I want to do a quick reminder, we are recording this webinar and we will send out a transcript of the questions and answers with the links to the webinar, the slide, and resources as a follow-up to you. So, all right, I'm going to go to our first question here. It says, we have outdoor seating and an outdoor pickup area for DoorDash that takes up part of the sidewalk. Where do I find city and county regulations regarding if I can keep that going this winter? That might be a question for us. I don't know, or maybe, I don't know, just you can always reach out to the team at One Eastside Spark, and we can help you identify who to go to in your particular city. But Anne, Rhoda, Jenna, Michael, any?
Yeah. No, I agree with you. Yeah, reach out to us. We'd be happy to do a little homework. It's always good to, I really work for Kirkland, Bellevue, Redmond, Renton, Issaquah, the East Side program. So feel free to reach out to us and we'll try to help you find that, because it's always good information to know. And I know that those things change too. So whether they're allowing outside parking style, restaurant related seating, and then you can overdo it too. There's regulations around that. So be careful how far you take that. So yeah, reach out to us. We're happy to help.
Yeah, and every city's different on what they're allowing and continuing. But I do know, as you know, we do talk with all of our 23 cities and towns in East King County, and they're all working their hardest to try to provide the best opportunity for our small businesses. Okay, I'm looking at the next question here. It asks, what messaging should I be using in our marketing to let our customers know that we've made improvements to our ventilation that will help keep them safer? Does someone from Seattle and King County Public Health want to take that one? Or maybe that's a Michael. Go ahead, Ann.
I don't know if there's, we don't have stickers on the wall, but I have definitely seen places where, they have said, we have maximized our ventilation. We are, back early in the pandemic, people were saying we're cleaning and sanitizing between all guests. Saying something like, we are achieving 5 to 6 air changes per hour per CDC recommendations. We're changing the air over. We're keeping it clean in here. That's something
Yeah, it sounds like a good social media marketing strategy to me as well. Just another reason to talk to your customers about what you're doing and reaching out. And reminder, One Eastside Spark has a marketing advisor, and she's fantastic at figuring out which social media platform is best for you to reaching your customers as well. Jenna, did you have something to add?
I was just going to say with our HEPA distribution, if you end up qualifying, we may be making little signs for you to show for your customers, similar to our masking signs that we've made. So if that's of interest to you and we have enough desire, it is easy for us to do that. So yeah.
Perfect. Anybody else, Rhoda? Are you good? All right, I'll go ask to the next question here. Okay. It says, some of the servers for my restaurant do not want to return to work because it doesn't feel safe to them. What changes can I make so they feel safer on a small business owner's budget?
Yeah, no, that's I'll fill that one. That's right in my bailiwick there. This is a challenge, and it is true. We've got, like I said, we've got people that are fearful of the virus and therefore don't want to come back. We got people that don't believe in being vaccinated, so therefore, if there's any type of vaccination mandate, they don't want to do that. So it is about getting those, sit them down, allow them to voice their opinion. Okay, well, what is it that you would feel comfortable doing? If we did X, what would get their ideas? I think what you'll find is that when the employee comes back and says, well, I do want to work for you. I really do want to work here at the restaurant, but this is what I'm, capable or functionally feeling safe to do. And you may find it's actually more than you think it is. And you may be able to put that person to work in a very functional manner. So really get their ideas, that inclusion, recognize that we're doing this together. We want you to be safe. If you're on top saying we're going to be safe as employees, the customers will follow. I think you're going to get a lot of results, but sit them down, understand their ideas. They may be more flexible than you think.
Yep, I think that's excellent advice. All right, our next question is, I operate a shelter for people encountering housing issues. Are there best practices I can follow when more clients are needing shelter indoors?
Yeah, we actually have a program. So we started out doing ventilation and sanitation in shelters and in spaces for people with housing, or at risk for losing housing. Just those congregate spaces. Go ahead and send us an email, and we can answer that, and also loop you in with some of our public health nurses that specialize in, in people that are suffering from trauma and may need some special assistance. But the things that we talked about today for a congregate space where people are closed in, the doors, the windows, the ventilation, adding HEPA filters, adding fans, that's definitely, but you give us, please do reach out, because we've got a good program for that and would love to be able to help.
Super, and I think we just put your contact information in the chat as well. Our next question, we said, let's see, we asked here, I want to keep our outdoor dining option going through the winter this year, which means I'll need to install outdoor heaters. Where do I find information on how to use those safely?
I'd like to say this is a Mike Price question, but I don't know the answer. I can only assume that they have a sticker on the side,
Yeah.
But it's funny you say that, because it is true that you want to be careful how you place them and things like that. And I think about how warm they can get when you turn them on. I don't know, unfortunately, but you know what? If you reach out to me through Restart Up 425, we'll start doing homework.
Yep, and I think we might have an answer. I know our earlier webinars covered the outdoor dining opportunity. I think we had the fire representatives from the fire department there, and I think it may. I don't know if it varies amongst the cities, but we might have some data on that too that we can follow up with. So let's see, here is the next question. It says, do you have any suggestions for increasing airflow or air turnover rates for childcare facilities? That might be a Jenna question. I remember the diagrams there was, or maybe Anne.
We can both go. And do you want to start off?
Oh, I was just gonna say, fill out our form. Yeah, we'll take a look at your space.
Yeah, every childcare is different, but like initial things are just turning on, if you don't want to open your windows and doors, turning on those kitchen and bathroom exhaust fans.
All right, great. Well, and it sounds like many times every venue, every location is just a little bit different. So really reaching out to the team here at Public Health through Seattle and King County really is a really great way for you to identify how you can improve your situation. So I think I don't see any additional questions. So I'm going to go ahead and wrap up the program. And I just want to thank all of our speakers here today for your time and expertise. We appreciate you all very much. I want to say thank you again to all our partners on the East Side who are working hard to support the business community. I want to make sure you bookmark this site. Hopefully the slide will change here right now. There you go, oneeastside.org/spark. There you will find key resources, information on our one-on-one advising, our weekly webinars, and grant opportunities as they become available. And another quick reminder of our upcoming webinars over the next couple weeks. And I want to thank all of you for participating in our webinar today. So until we see you again, this concludes our program. Thank you.